Do you think we can rope in Meryl Streep or George Clooney to come and talk to us?
I think we can. I'm in LA. We're in the right city for it. I'll work my contacts. You can work your contacts in
Yeah,
health. You can
no.
work my Hollywood and movies. That's a
Hey,
recipe for.
you talk to your people. I'll talk to my people. We'll see what we can
Yeah,
do.
I was just thinking. You and I, we did meet each other at Soho House Malibu. I mean, it doesn't get much more LA than that. That was
That's
back.
right. But just to inform people, it wasn't like we were drinking at the bar. What were we
That's
doing?
true. We were doing a morning yoga class
Yeah.
on the outdoor patio overlooking the Pacific Ocean. So definitely not
My
toxic.
Avatar 5's there.
Right. Little did we know that the world was going to change a week or two after
As a
that.
fun anecdote, like I was coming back from LA and I was kind of sad because I was like, oh geez, I'm gonna miss those mountains and ocean and that like amazing, weather. It feels like Groundhog Day every day where it's beautiful and sunny and perfect climate. And I'm coming back to Toronto and out here where my parents are in the county, and it's beautiful summer weather for about 2 months of the year. The rest of the year's harder. I also thought, because of the pandemic, like I had to quarantine coming back. If you don't have any known contacts or exposures, and you have no symptoms, and you don't have a temperature as they test you at the airport, you only have to quarantine. You don't necessarily have to isolate. The two are very similar. For 14 days, you have to remain in the home. You have to not go out unless it's for medical care. So you're pretty much confined to the home. Isolation is a little more strict. You can't engage with anyone, even other people living in the home. You've got to be, even more. But I guess what I was thinking is, imagine if they'd have told you or I, like, after you get back from a trip, if you've been to an international destination, you can't go back to work. You have to stay at home and rest for 2 weeks. We're in kind of phase 3 of kind of our opening up of policies to go sway in the direction of somewhat normalcy again. So we're allowed to have kind of smaller group gatherings, but everyone's still wearing masks. I think it's a group of up to 10 is allowed to meet now in public. And yeah, there's a lot of more openings in terms of non-essential services and things. So they're talking about kids all going back to school in September. And
Seeing, I just struggle reconciling what I see in the news in terms of the numbers with what I see on a day-to-day basis, because you look at the numbers and they're getting a lot worse in LA and throughout California. But I talked to my doctor friends who are based here in LA, and they say those numbers are really concentrated in the east side of LA and a lot of the lower income and minority communities, Blacks, Hispanics. LA is one of the highest food insecurity cities in the country. I think I read somewhere that 20% of people of color have food insecurity on a daily or weekly basis. And we know that obesity and diabetes and metabolic syndrome are correlated with much worse outcomes for COVID. So I think that's certainly a part of it. And it's been rewarding for me to be part of programs like Hunger Action LA and World Central Kitchen that are donating hundreds of thousands of meals. When you think about public health, communication and messaging is so important. And I think it's never been more apparent just that the challenges and the limitations of public health and just how fractured the ecosystem is where people get their information from. I mean, 20 years ago, it was 3 TV channels, no internet, a couple trusted newspapers, the New York Times.
mm-hmm.
Now it's thousands, hundreds of thousands of websites, hundreds of different TV channels, social media posts. Nobody knows what to believe. Everybody's following different people. Influencers and thought leaders who may have questionable scientific backgrounds are really setting the tone, I think, for a lot of people.
It's really, I think one of the other things that's really difficult is that so many people in those populations do have a lower income, and which means that usually there's more people living under, a lot of these subtle factors, like more people all together living in one household, for example, and that, if one person gets affected, the 8 other family members living around them, it's inevitable. And for that one person to get affected, maybe it's a lot more easily than other families, because maybe the people that are working in that home are probably, working are comprising most of the nation's, factory type workers, or, people with jobs in production and grocery stores and things. So I think, part of the reason why I think we're seeing that in that demographic is because of their exposure risk. Their health factors, and other comorbidities may later on increase those, the morbidity, mortality of the virus. But in terms of actually increasing those incidence rates after testing in those populations, it's the transmission factor, I think, is a lot more real for them based on their living circumstances and their work circumstances. They simply can't stay at home, a lot of those families, if they wish to survive.
Yeah, I think you're absolutely right, and that's probably one of the most important, if not the most important factor. And I was just reading a really interesting article in the New Yorker about Tyson, the second largest meat producer and meat manufacturing plants. Yeah. There's been reports of huge outbreaks at these meat packing facilities, and these are places where, as you say, low-income wage workers who have no choice but to go into work, and the distancing is not possible. If anything, the most recent mandates from the US FDA and the agencies is you have to process more chickens. They call it BPM, birds per minute, from 140 birds per minute to 175 birds per minute. So that the chances of being able to distance and have adequate PPE are just close to nil. Mm-hmm. So between that and just, as you say, lower income people being, crammed into smaller, co-living situations, they're more likely to be exposed to the virus on the job, just out of economic necessity, and then also more likely to pass it on to people that they live in close quarters with.
Mm-hmm. Absolutely. Mm-hmm. I think you're right. I think one of the biggest things is inconsistent messaging. I think, and where does the inconsistent messaging come from? Well, we talked about a few things, suboptimal collaboration and malalignment of goals between health and government sectors, I think is a major thing. You've got scientists, virologists, epidemiologists, medical doctors, all kind of reviewing what's happening in real time and trying to publish and trying to collaborate on data, and give those proper warnings, kind of big issues, not only in the US, but across the globe. And I think we see that for through many different countries. And the reaction times, of course, do you react too quick? There is this, or what are the consequences of reacting too slowly? And I think when you look at India, for example, India had a really swift, hard lockdown, and they came across so rapidly with their closing of all travel that a lot of people that were working in cities couldn't get outside of the city to even go back to where their homes were to see their families. And so they had to stay in the city where they weren't necessarily even wanted. And this led to, huge rates of transmission of the virus, even well under lockdown, which, obviously was very counterintuitive to their philosophy at the beginning. And then they ended up with the situation they're in right now, which is, still numbers escalating at a crazy rate. These, I guess, are the trade-offs that you consider when you see other countries making different decisions based on whether to shut down and how they enforce that, or how strict it is, compared to how they see the country success on other parameters and the longevity of that. So, I mean, everything is a trade-off. And when you're looking at these models, I think at this point, in my opinion, it's impossible to forecast on economic models and health models. I think, I think you would agree that there is still so much we have to learn about this virus, that we're seeing more and more evidence about how the virus behaves, about how it affects the human body, and some of the acute effects that we now attribute to the virus that we didn't know before, and the chronic conditions that may be a real factor in the long term. So even, based on the sheer health factor, we're probably starting to become aware that there are long-term things that we simply cannot predict right now, but they will become very real. And I think the same is true for economic changes that have happened in different countries. I think we have enough countries involved too that we will start to realize these concepts of, when differences in strategies and approach, how that has actually affected the company or the country in terms of their total health.
Yeah, I think one way I think about that issue is just how, on one hand, this is such a new virus and there's still so much we don't know about it. And, you ask 10 people about vaccine development, you're going to get 10 different answers. And then the treatment and the therapeutic landscape is still very uncertain. We have a couple treatments, dexamethasone, remdesivir, that have shown some promise, but far from a panacea. And when I talk with hospital leaders, I work with a lot of hospital executives. They say, look, we're not banking on vaccine anytime soon. We're going to take all the measures we need to enforce distancing, ensure that everybody has PPE when they come in, ensure that everybody gets tested, and just really a lot of just adjusting physical environments to this new reality. And, that's the big debate we're having about schools right now. How can schools safely reopen? But I had this conversation with a friend who works in a different industry. He works in private equity, which is a field that's all about predicting the future and making long-term investments. And when you're in private equity, you need to think about, you have these financial models that look into the future, not just a few months, but a few years. What's the cash flow going to be like in year 3 or year 4? Mm-hmm. He was telling me that for these models, you have to make assumptions about what the state of the world is going to look like. And even though, a medical scientist will tell you we don't know about a vaccine, the reality is the way the world is being run by these owners of capital and private equity, they're making assumptions, and they're making assumptions that, all right, 1 year from now, there's a 40% chance we're going to have a virus that's going to provide X% protection. And that's going to mean that, these people can go back to school. And so, even though we don't know a lot about the way the science is playing out, I think there are some really important discussions that are happening right now about, how can we take what we do know and use that to guide the best path forward.
Absolutely. Absolutely. I have another question for you. I wanted to talk a little bit about new biological findings with respect to the virus itself and kind of manifestations of the disease and outcome. Maybe we should talk about that a little bit, but I definitely want to ask you a question about vaccines.
A vaccine, on average, it takes more than 10 years for a vaccine to go from preclinical development through all the phases of clinical trials. There's a lot of data that needs to be collected about not just efficacy, but safety. Mm-hmm. And I think the public health messaging is going to be key for this, because there's just so much, especially in a country like the US, where there's, a strong anti-vaxxer sentiment and just a lot of skepticism. I just wonder about kind of what the threshold, what the burden of proof is going to have to be for a vaccine to get people to actually, start using it.
I think that's an amazing question. There was a publication, or there was a report that just came out of the University of Chicago, actually, on a survey of asking Americans about their viewpoint on a vaccine. At least 50% of the people, so I think it was in fact 50-50 of the around there of surveyed applicants, said that they would have hesitation or would not take a vaccine if it was available to them today for coronavirus. And I think what you just said is hugely important. What is the level of confidence? I think there's vaccine skepticism, not only in the US, but coming from so many different areas. You have very pro-science, very pro-health people, even physicians, who are very skeptical of a virus that is being produced in almost a time, or a vaccine that's being produced in almost a time warp speed. I think that there's a lot of concerns. The publications that we have so far on some of the 2 leading viruses that are still only in phase 2, we don't have any in phase 3. There's about 130 in total across the globe that have been approved for preclinical study. But when you look into it, there's 23 in total that have started trials in humans. 7 of them are coming from Canada, and only 2, the Moderna, I think you mentioned, and then out of the UK with a combined effort with AstraZeneca, I think the other company, they've just published in the Lancet on their phase 1 and 2 trials, but how they've expedited things. The WHO, as part of the Solidarity trials, have now allowed vaccine development to happen a lot faster because of the urgency around this. Everybody wants a vaccine. We're crying out for it. We think the vaccine is essentially, on many respects, is viewed, I think, by a lot of people, as something that will bring reassurance, that will restore and bring back to a life of somewhat normalcy. And I think, because of that urgency and that hope, of course, the 10-year process has been, major efforts have been made to try and expedite that, such that there are even overlapping phase trials, which really does bring into question, what is the real safety and efficacy here in something where we're seeing publications and the population that under study is of 10 people, and is this really enough power to instill confidence in the scientific community to release this and to move it up to the next phase levels. I think, on the basis that it takes the human body to generate those serological levels of neutralizing antibodies to even, analyze. I mean, it takes a couple of months, and then the long-term effects. I mean, this is one of the biggest things with vaccines. And originally, if you look back in history, why there were so many concerns with vaccines in general, its effect on young kids, and the suspicion that it generated autism. And when you look back into several other social concerns about vaccines stemming out of that, and even before that, when we started with measles vaccine, I think you do see a lot of skepticism. And because that, you've got the group in Texas, you've got a spectrum of people that are also very critical of the vaccines, not just, of course, science based on how rapidly the evidence is coming out, but you've got groups in Texas that are formulating these very pro-choice standpoints, and then you've got very somewhat granola community parents that are like, nothing that's outside of natural going into my child, and of course that would include vaccines. And so you've got if you think that there's an archetypal anti-vaccine person, well, there's not. I mean, it's all education levels, it's all different types of society, and I think because of that, this is going to be a huge barrier to the implementation of a vaccine across the globe.
Yeah, I think that's very well said. And I think it goes back to what we were talking about earlier, where just public health messaging has been such an integral part of our nation's response, or just our failure to respond well to this. And I think it goes even more so for vaccines, because when you study the history of medicine and public health in this country and in the world, it's becomes quite clear that vaccines are the number one, or one of the top public health interventions of all time in eradicating smallpox and polio. And my late father was a cardiologist, used to love telling me the story, the kind of like medical scientific detective story of how they came up with the smallpox vaccine and how they used it to basically eradicate this disease that had previously been one of the most deadly afflictions and causes of death worldwide for decades, centuries. So I think part of it is just that public health awareness. The science is super interesting, and I think it's fascinating. Your point about the neutralizing antibodies versus cellular immunity, and new papers are published on that all the time. But I think the way I think about vaccines is that it's a multi-pronged effort, where the scientific development really needs to progress in parallel with these public health initiatives. Because whether it takes 6 months or a year or 18 months for a vaccine to be available, if people aren't willing to take it, and if communities aren't able to protect themselves, then we're not really going to get anywhere with this.
Yeah, exactly.
It's a challenge, and then there are other questions about who's going to be actually manufacturing the vaccine. The U.S. government just gave a $1 billion grant to Novavax. There are some other big companies that I guess have the manufacturing capabilities to start making these vaccines at scale, because we're going to need, on the order of 1 billion doses of these. And then you get into questions of who gets the vaccines first. Is it the essential workers first? Is it the kids? Mm-hmm. And so just, the more you dive into this, the more thorny issues there are. And I think they go into all different fields, not just medicine, but sociology and economics and government. And just it crosses through so many different fields of life.
Very true. Yeah, I couldn't agree with you more. There's definitely a strong integrative approach that is absolutely in demand in order to roll this out. And then I think it brings in a little bit of politics as well, given the fact that, the government appoints the FDA approval people. It also brings into question, do you do you trust your political leader, knowing that at the end of the day, that's who it will have to go through as well. And I mean, all these things are definitely, it's going to be very interesting to see how it all unfolds.
Yeah, and I think if I had to guess, I think that the stakes are so high here that I hope that a scientific consensus will emerge as a vaccine comes out. It may not be kind of a one shot and you're done. It may be more like the flu shot, where every year you need to get a different one because the strain may evolve. We're already seeing evidence that the antibody levels are not consistent. Someone who maybe just got a low dose of the virus is not going to produce many neutralizing antibodies. So it's probably going to have to be given in conjunction with the flu shot. I've heard people say it can go from a quadrivalent flu shot to a pentavalent flu shot with 5 different strains people are getting. But I think the best argument I've heard is if you can frame this, getting the coronavirus vaccine, as a way to protect your community. You're not, a little bit like the way we're trying to frame the mask messaging. You're protecting not just for yourself, but you're helping protect your kids, the people in your community, the schools, your coworkers. I think the stakes here are so high that we really need some kind of scientific consensus to emerge. And whether that takes 1 clinical study or 50 clinical studies, I'm hopeful that we will get to that point. Yeah. I'd be curious what you're seeing in terms of oncology and with cancer patients. We talked about, I guess, a couple of things. One, clinical trials, how there's some challenges with clinical trials and new cancer drugs, but also just the challenge of chronic illness with cancer patients who maybe are shifting to telehealth and virtual care. Maybe can't see their doctors as often as they normally would. And just how are people thinking about weighing those risks of seeing their doctor versus taking care of their condition at home?
Things are slowly starting to reopen now. Again, there is a lot of caution as to still among people with even acute concerns, whether they have medical conditions or not, whether or not they should go into the emergency department or the hospital. And I think we do have the advent of telehealth, which I think will start to cause people to make that transition and start to have more of a user experience with telehealth and start to move into that area, which is becoming bigger and bigger by the almost by the second. So we've seen market projection escalate hugely in the industry of telemedicine and digital health. I think what we can do at this time is definitely encourage people to practice, social distancing, to practice, hand washing, to practice limiting exposures. And by limiting exposures, it does also mean, trips to the hospital for what's necessary, but what's avoidable, maybe they can achieve through telehealth. And then, of course, none of this at the jeopardy of their own health. It's just tricky to bring education to people to let them know, what is really jeopardizing their health, when to go out and seek help, when to seek help through telemedicine if they're afraid, and to be proactive and to reach out to resources, because just because of the coronavirus, doesn't mean that the rest of their health risks are set to the side.
I know that's something that a lot of people are struggling with right now. Just the question of how serious is serious enough that it's worth going into a hospital versus just talking to a doctor remotely. And I think that's something that, from what I've seen, that medical professionals in all different fields are struggling with. And maybe it's the kind of thing where it's a little bit easier with mental health, where you're just giving talk therapy, versus something where a physical exam is really a lot more important. And I know with diabetes and with heart disease, there are some real limitations about how much information you can really get just from talking to a patient or just seeing them on a screen versus actually being there to give them a real physical exam.
Absolutely. Yeah, I agree. What do you think when you see death rates? What do you think of that, of the numbers that are published? do you think more along the lines of, it's an underestimate because when people die, they've had all these other, health issues and they die. Well, they would have probably died, but coronavirus just kind of expedited it a little bit, or, they're dying and because of the false negative reports, they're probably actually dying of coronavirus. But those things are going underreported? Or do you think the opposite? Do you think that those death rates are probably lower than what they should be? Or what is your view on that? I've heard lots of different arguments.
Yeah, that's one of the most discussed and one of the most important questions I think that's going on right now. Why are the death rates lower? And I've heard a variety of explanations put forth for this. I think the most obvious one is there's a lag. We know that there's a 21-day lag between when an infection is reported and when a death happens on average. So it's going to take time to really suss out, how many people are dying from this most recent surge. And then some people are saying, all right, the shift has been more towards young people. And I think the data does support that. As more young people get sick, the death rate is going to be lower. We know that young people in their 20s and 30s, their death rate is an order of magnitude lower than those in their 70s and 80s. Treatment is a third potential explanation. I've seen reports that we're learning how to treat these people better. My impression is that that's kind of a smaller piece of the puzzle because the treatments maybe have improved on the margins, but overall, I think from what I've seen, clinicians are still very limited in their ability to treat patients other than just making them more comfortable, giving them oxygen, putting them on a ventilator when they need that. And then finally, it's the fourth is the point that we discussed last time we talked, the underreporting. And I really, I think this is the kind of thing an investigative journalist needs to publish a long piece on, because I imagine that there probably is a lot of underreporting going on. I think last time you brought up the point about blood clots, how there's an emerging view of this as a vascular disease. And a lot of people are probably dying of blood clot related issues that maybe are not being categorized as COVID, whether they even make it to the hospital or die at home. I know in New York, there was a big issue that people thought they were undercounting the prevalence rate because of so many people who were getting sick at home and not even making it to the hospital. So I think underreporting is a big thing as well. And I don't really know the magnitude of that, but I suspect it's, and then you also go to the question of incentives. Are there any perverse incentives where maybe hospitals are incentivized to either over-report or under-report a patient as having COVID due to reimbursement? We know that some hospitals get reimbursed more or less depending on what billing code they use for a patient. So that could be a factor as well.
Wow. Yeah. Wow. That's interesting. Jeez.
One of the many, many failings of our nation's healthcare system is it varies by state to state. It varies health plan to health plan, commercial versus Medicare versus Medicaid. And every hospital has its own EMR, its own electronic medical record system. That they typically don't really talk to each other.
That's right.
And when you have these really siloed data systems, lack of standardization in reporting, and lack of interoperability from one system to another, that's when you get just very, what we call in the tech world, very messy data, just unreliable, messy data, where it's really hard to integrate. It's hard to take this report from Alaska and this report from Canada and this report from California and make it all apples to apples and really compare them across different regions. That's what we need to help formulate an effective response. That's what we need to really figure out which regions are doing better than others. But that's, I think, one thing we're really missing right now.
Yeah, I fully agree with you. I couldn't agree with you more. I think, we do have the WHO that we know is, been very proactive and very observant and has definitely been involved, as a massive organization with the coronavirus. But you'd almost wish that it would reach down almost, a little bit further, and there would be even more collaboration on the standardization of some things. At least they've tried through these solidarity trials and making things equal among, socioeconomic strata of certain countries and cultures, and bringing access to things and access and reporting of those trials, at least in a very consistent manner. But it's there's so many more areas where, if we were in a more collaborative and if data transference happened a lot more seamlessly, we could expedite those answers and we could arrive to collective conclusions a lot more quickly. Perhaps this is one of the silver linings, if there is anything to be said about the coronavirus and it hitting humanity, is that, yes, the internet, we are used to being connected from a distance. This is potentially forcing us to look into so many ways of being even more connected at a distance on numerous levels.
Yeah, I agree, and I think that's a nice way to think about this this challenge, is thinking in terms of the silver linings, because I think clearly there are going to be some, whether it's just improving access to healthcare by making telehealth more ubiquitous and more accepted, and giving people who are maybe in very remote or rural parts of the world access to the same kind of high quality healthcare that's available in big cities. People talk about how the death rate could be a lot worse. It could be more like the 1918 Spanish influenza, which killed millions of people. I think this is going to be a wake-up call to be better prepared in terms of having stockpiles of testing and reagents for testing and vaccines, not to mention PPE, which was more of an issue in the early days of the pandemic, less so now. And at a fundamental level, I think just science education. I mean, as a science nerd, someone who has always loved science, comes from a family of doctors and scientists, I think anytime there is a global crisis, it's just like 9/11, I think, inspired people to get into governmental affairs and foreign relations. I think this type of situation is likely to inspire a whole new generation of scientists.
Mm-hmm.
And I think the more we can just frame these people working on these vaccines and these therapeutics as the real heroes who are going to be quite literally saving the world.
Mm-hmm.
I think it's inspiring for me to think about that. My nephews who are 9, 14, and 15, who love science. It's inspiring for me to think about people that age, using this situation to get them motivated to pursue careers in science.
Wow, that's amazing. Yeah, I hear you on that one. Absolutely. Serology testing, is that something that's more publicly available in the U.S.? Are there a lot of people getting the antibody serology test?
Yeah, I haven't seen the latest numbers on that. I got an antibody test a month ago. The way I see it is that it's antibody testing is so important for surveillance and just to understand prevalence rates in different regions. But I think there's still a lot of confusion around it.
Mm-hmm.
The latest data I've seen is that the results are quite unreliable.
True.
They have as
Yeah.
high as 30%, not being accurate. And so there's not so much you can really, and not just that, but it's not a binary thing, right? These tests, a strip lights, as a chemistry person, I know that it detects the presence of a molecule, and that molecule, its presence makes the strip light up as red or blue, a little bit like a pregnancy test.
Yes.
But we know one of the few things we do know about antibodies and vaccine development is it's not a binary thing. It's not like you're either immune or you're not immune. I mean, maybe you got the virus, but you got a very low dose, mm-hmm. and your body didn't produce that many neutralizing mm-hmm. antibodies, or maybe you didn't get the virus. There's just a lot of ambiguity and uncertainty. So on one hand, I think there's still a lot that needs to be improved about the serology testing. Mm-hmm. On the other hand, I just read a New York article about the response in Germany, and one reason Germany has been so successful is they've used it not so much on an individual level, but for surveillance testing. The concept that even if these tests are imperfect on an individual level, if you test a wide swath of society and do that on an ongoing basis, then a picture will start to emerge. A picture that, all right, this town in Cologne, these guys have suppressed the virus. This area over here is on the verge of another outbreak, mm-hmm. and just really help guide the government response about where they need to direct mm-hmm. resources the best way.
Absolutely.
And I haven't seen that type of surveillance testing framework really mm-hmm. rolled out here in the U.S. in a coordinated way. Mm-hmm. I don't know if there are government leaders that are planning to do that. I would think that would make a lot of sense along with contact tracing. But then again, not a lot about the U.S. response has made a lot of sense. So,
well, I think it's very circular as to, the whole combination of things you suggested. That infrastructure would be beautiful. It would be amazing to see how many people are exposed to the virus, how many actually become infected after exposure, how many after exposure and infection develop immunity to that, is that immunity lasting? Does it prevent a reinfection? Are people immune for life if they develop these antibodies that are detected? I think all of these questions. And then if you're looking at, contact tracing in combination with that population data and evidence on what's happening, in individuals in terms of, transmission, I think that would be incredibly enlightening and useful to, how we're evaluating and the decisions that we make in the future on removing, policies of social distancing, getting kids back into school, et cetera. I think it would have huge ramifications to getting people back into the workforce as well.
Yeah, absolutely. The serology testing, it's such an important piece of the puzzle. And it's not just the accuracy of the tests, the accuracy and the sensitivity. Those are two different metrics that people talk about, these serology tests. In terms of just identifying people that have these antibodies. It's also just the way these studies are conducted. I mean, they've generated so much controversy. We've seen, there was a famous Stanford study a couple months ago that suggested up to 20% of people in parts of California had been infected. And then there was all this controversy in the scientific community about the way the study was conducted, the control groups, selection bias, the way they recruited volunteers for the study from Facebook. And a lot of doubt has been cast on that. And then a month ago, there was another report coming out of New York suggesting, again, that maybe we undercounted the number of people who have had the virus. Maybe it's 10 times higher than we thought. And when nobody can agree on the right way to even analyze these studies, let alone how accurate the tests are, that's what you get. You get this just wide range of estimates in terms of what is the real infection rate. And I think it's still early days, but I think we're going to need to do a lot better in terms of both getting the medical device and the pharma companies to manufacture better tests, and also just for more of a scientific consensus to emerge around the right way to conduct these serological prevalence studies in a way where, it's never going to be 100% perfect, but you want to get enough of a picture to say, all right, Canada, where Kate is, this is a green zone, LA, where I am, this is a red zone, because those types of real-time determinations, I think, are going to be so important in just helping the economy reopen in a smart way and minimizing new outbreaks when they do occur.
We're still in it, where it's still really important to, keep those practices that will prevent transmission and abide by those things until we start to see numbers drop. Also, being aware of some of the things that you have suggested and stimulated and provoked in terms of accessible critical thought, like what are the activities that are putting me at risk with your decision tool, which is so enlightening and I think a very effective thing. I've shared it with as many people as I can, but I would love more people to learn about that, or at least, take their daily routines to test with the algorithm and see, what are things I'm doing? How is it counterproductive? In some aspects of my life, I'm clearly off the charts and I'm doing so well in terms of my limitation of transmission, but this one or two thing that I'm doing is not, not equating quite appropriately. And those things are I think personal things that you can look at that do help us to modify our behaviors appropriately and really reduce that risk.
Yeah, absolutely. And I'm glad you got some value out of the COVID risk model that I built. That started off as just a fun little experiment and chance for me to get into the weeds of Excel and modeling and public health data. And I'm working to push that to the next level and hopefully to turn that into a mobile health tool that people can use to assess risk. And I've talked with some epidemiologists from Harvard Medical School to get their insights. And I'm talking to some developers. But I think there's still a real opportunity, because on one hand, every week we see new activity risk scores and they tell us, all right, these things are green, they're safe if you're outside. These things are red. Obviously, we know don't go to bars. Whatever you do, don't start singing karaoke at the top of your lungs in a bar next to somebody. I mean, I think at this point people have like a rough idea of what risky activities are. On the other hand, there's still a lot of uncertainty. And when my local gym opened up, I think a lot of people were rushing to go back in, and there was an attitude like, all right, I've stayed at home for 3 months. They're doing everything right. They're taking people's temperatures. They're handing out sanitizer. They're only letting a certain number of people in. It must be fine. But of course, no, it's not fine. And now we're seeing stories that people going to Equinox are getting infected. They're spreading the virus. And just because some of these places were allowed to reopen doesn't mean people should just blindly walk back in. And I think there's going to be ongoing uncertainty about this type of situation and what's appropriate, what's not. And it's so complex because it's not just a bar versus a restaurant. It's not just indoors versus outdoors. It's what part of the country, what part of the world you're in. What's the local prevalence rate? That matters. Is it 20%? Is it 1%? What's your personal risk level? I think a lot of people know that, if they're immunocompromised or if they're above age 60 or 70, they have a higher risk level. But some people still don't really understand their comorbidities and individual risk. And I think there's an opportunity to really kind of combine all these factors into some kind of integrated decision support tool.
Yeah.
And I think whenever the risk is really kind of abstract and hard to see, the more there's an opportunity for digital health to really help people and guide healthier decisions, whether it's nutrition and more people are using, food and nutrition trackers to monitor their calorie intake. Or I led a project for a healthcare company doing a carcinogen exposure meter for smoking cessation. We know that getting people to stop smoking is so challenging. And we were looking at ways to look at biomarkers and changes to DNA and cellular level damage to quantify the effect of cigarette smoking, to say that, after, 6 more months of cigarette smoking, your chance of cancer went from X% to 20%. And I think if there's a way to do that with COVID risk as well, knowing that you're never going to fully eliminate the risk, but if you're going to shift to a harm reduction model, I think that has the potential to really help steer people towards healthier, day-to-day lifestyle decisions.
Absolutely. Yeah. I get a lot of questions coming about the cancer risk. I think, we've seen from many published reports that cancer patients are more prone to a severe infection from coronavirus than the general population, almost twofold in manifestations, morbidity, mortality. And I think that comes from a couple of things. Not only the malignancy itself lowers your level of immunity and your ability to fight something like an infection, especially the coronavirus, but especially if you're on therapies that are toxic to the body, like chemotherapy and radiation, it's almost like, you've got such very little defense in light of your body going through so much of a war that any additional hit makes it incredibly difficult to overcome. So we are seeing, in the cancer patient population, those who are exposed and contract COVID-19, it's a very serious matter. But then the corollary is also brought into light when we see kind of the physical manifestations and then try to associate that with the pathophysiology of the virus affecting so many different organ systems beyond just the respiratory tract, and these concepts that it affects the blood vessels, and it generates almost progenitors that will form new blood vessels in a very rapid way that is a little of a bit of an unnatural process for the human body, and causes even, because of cells replicating so quickly, because of this concept of angiogenesis that the virus environment creates, we see a lot of errors being made in those cells. And because of that, you could see how rapidly dividing cells, prone to even developing more mutations, that maybe one of those mutations could become a cancer. And that's kind of the pathway that happens normally due to inflammation, and the inflammatory process as a contributor to development of cancer cells. So really, when it comes to coronavirus, and this is the way we see it with numerous viruses that we've studied throughout the past that have been directly correlated, if not the etiologic or causative agent of a cancer, like hepatitis C, in liver cancer and non-Hodgkin's lymphoma, hepatitis B and hepatocellular carcinoma, HIV with many age-defining cancers, and HPV, for example, with cervical cancer, and numerous other types of cancers. I think we've seen a direct correlation with not only the direct viral effect and its insertion into DNA and disruption of cellular processes, molecular processes, to the effects sheerly based of having an active immune system and the whole pathway that's ignited when you have inflammation and rapid cell turnover in the body. So there's definitely going to be some risks from multiple directions, and I think it has implications to cancer.
Yeah. And speaking of the immune system, I have a question for you as a doctor. You know, you hear a lot about the immune system, and obviously the immune system plays such an important role in the progression of the disease. On one hand, being able to fight the disease off initially, and then on the other hand, the cytokine storm and the inflammatory response ultimately causing such devastation and destroying the endothelium and causing so much damage and leading to these horrible complications that we're seeing. What can people do on a preventive basis? I think that's probably the number one question. You know, everyone's obsessed with enhancing their immune health, you know, taking vitamins, supplements. I think if this leads people to be healthier and have better diets and exercise more, that's a great thing. I've also heard some people a little bit skeptical. Well, you don't need to boost your immune system. Your immune system exists. You know, eating some superfood, echinacea, is not really going to move the needle that much. Where do you stand on that?
Yeah, I think I can't speak enough to the importance of, you know, preventative through lifestyle measures and trying to, you know, have a healthy immune system through changes you can make on a daily basis. I think that, you know, being proactive about your health on many levels will help you develop immunity to disease and help you fight infection. And I think things like, you know, continuing to get properly, you know, vaccinated vaccinated against the viruses that we do know causes harm, and boosting our immune systems to fight against those things is one way of raising the levels of your immune system. And that's a very more direct way that people can visualize quite easily, but also being screened for, you know, particular diseases and risk factors for them, being screened for viruses that cause cancer, being screened for cancer through mammograms, through prostate, you know, testing, and chest x-rays if you've been a long-term smoker, being proactive in knowing, you know, how to access these things that will help with early detection and save lives. We know that early detection does save lives. The earlier we find things, the more we avoid complicated and more serious issues from that disease, and therefore lower health costs in general. I mean, by detecting things early, it saves everybody. So that's one thing. And in terms of lifestyle, I mean, there's several contributors that we know affect immune systems directly, such as sleep, diet, exercise. I mean, it's the combination, I think, of all of these things together that really do give your body the best fighting chance, literally. Making sure you get enough protein such that your body can produce those antibodies themselves, which are completely made of proteins. Making sure your diet consists of all the amino acids and essential vitamins and minerals. You know, taking a multivitamin every day, trying to eat lots of fruits and vegetables, things that are nutritious, that are give your body the building blocks to be able to build those host defenses when the time comes, whether it's, you know, through that innate immune process or the adaptive immune process. These pathways are metabolically linked, and rest and recovery is also very important to rejuvenation and allowing your body to, you know, to fight. Also, these daily challenges. I mean, I've heard a lot of people make the comment, well, if we're social distancing and we're young, or we're hand washing frequently, we're not exposing our immune system to, you know, the regular, you know, frequent insult of pathogens that maybe aren't so severe, but enable our immune systems to be strong. And I think that is a bit of a concern. I think with kids not interacting or at school or engaging with each other and out in the world, there is a little bit of a concern there, but I think the risk right now still outweighs the risk of maybe having a temporary pause to your immune system. And I think we could probably, if we are healthy and proactive in as many ways as we can be, maybe we need to get a bit creative now with our with our exercise and things like that. But it maybe shorter than we think in terms of the consequences on our personal immune systems.
Yeah, that's fascinating. And you mentioned the importance of kids getting their hands dirty and getting exposed to microbes. And I was just listening to a podcast with the author of a new book called Clean, all about how changing conceptions of what it means to be clean, and how originally clean was a religious conception. And then it came to just, all right, you need to use tons of toothpaste for your teeth, otherwise they're not clean, and soap on your hands. And maybe in some ways we've gone too far in one direction with all the antimicrobial soaps and just the importance of, beneficial microbes and for the microbiome and skin health and gut health. But as you say, you're right. We don't want to do that at the expense of kids then getting infected with the coronavirus. And so how do you weigh these competing health objectives?
Mm-hmm.
So should we end it on a positive note?
Yeah.
We've talked for over an hour. What's something that gives you hope? I think it's easy to get bogged down in all the doom and gloom of all this, but when you think about where we're going, what the opportunities are to, deal with the situation better and maybe leave the world in a better place, a year or a few years from now, what gives you hope?
I think what really gives me hope is, and I'll use a bit of a, on our transition to try and make this an uplifting, transition. The war is when we create sharper weapons and more effective weapons. And I think that we are in a war. I think it's humans against virus and all of the, umbrella effects around that, that are surfacing and bringing to light, these issues of public awareness. And, there's that concept of it gets worse before it gets better. And I think that's very real. I think people are really putting a lot of concepts, a lot of social issues, a lot of technological issues in the limelight right now. And I think that it's causing us an entire reset. We've got downtime. We have, a lot of people that are now becoming more forward thinking than ever before. How do we adapt to the new normal? What will the new normal be? And I think it's actually a really exciting phase to be in, because I think what will come out of this is a society that is a lot more cohesive and collaborative. I think at the end of the day, social media, it would be interesting to see how people that have been heavily involved in social media, what those reports, what they've observed, as to how society has changed through using social media, even more potentially through the pandemic. I can only assume, but I would love to see kind of the science around that even. I think we're getting better at using innovative efforts and collaborative efforts within the healthcare system to expedite and maybe do away with things that were a little bit counterproductive and only slowed processes. So I think there is going to be a resurfacing and a remodeling of healthcare systems, and especially telemedicine and digital health, I think, is going to play a bigger role and hopefully reinforce the necessity of cross collaboration and availability of information. I think there's still a lot of questions around that in terms of medical, legal, and privacy policies, and perfecting our user experience with, feeling comfortable talking with a physician. How can I relate to this person? How do I develop an appropriate connection to a provider? Not just physicians, but anyone in allied health. All of these telehealth services that are coming on board that are very effective, but again, it takes comfort on the provider level, and on the patient level, and this could take time, quality of care efforts. All of this will be a bit of a process, but I think it's leading us toward an exciting one, because there's nothing better than being able to be anywhere and receive information, receive comfort and receive life-saving medications from no matter where you are. So I think these things are going to be really exciting, and I think they're going to change in pretty amazing ways, quicker than we ever thought before.
And I think the more we're forced to do things remotely, the more augmented reality and virtual reality are going to be really cool ways to help people get through that. I mean, I'm not really a big video gamer anymore. Speaking of
Yeah.
being a kid, my best video game days were in the 80s. But I think that there's going to be some pretty cool applications around AR and VR that this whole, and maybe related to the whole telemedicine trend as well, but just out of necessity. I mean, when people are forced to live more of their lives remotely without being able to interact in person, there is more of a demand, more of a real market need to get those kinds of virtual interactive experiences.
Mm-hmm.
Like, imagine how much fun this is, chatting to you on Zoom. Imagine if, we saw each other's 3D avatar and could actually like high five our avatar and like, walk around in circles and do a little choreographed dance. Like, maybe that'll be our next Zoom meeting in 3D.
Well, yeah, absolutely. I think it would definitely be more engaging and interactive. And for that reason, if only it just makes you wonder, how those applications are all going to come downstream and infiltrate and make things a lot more vibrant and a lot more understandable. And again, make messages even more effective than they've ever been. And hopefully that technology and that creativity is going to cross collaborate, bring those applications, from the entertainment sector, video game. I mean, the stuff that I've seen, if only we put that much, a lot of dollars or invention brought a lot of those people over to radiation medicine and had that as a force as well. I think we'd be seeing some pretty interesting things happen with image-based therapies in the medical world.
Yeah, and I know therapeutic VR has gotten a little bit of traction in healthcare for helping people deal with chronic pain. And I know even in oncology, I have some friends at the UCSF who have been rolling out therapeutic VR implementations to help cancer patients getting chemo, to help them with their quality of life. And I think for me, I've always been fascinated with opportunities just combine, Silicon Valley tech development with Hollywood style movies and storytelling. And I think when you combine those two things, that's when you can really change the world. Mm-hmm. And just really get new messages across. And I'm personally really excited about the opportunity for Hollywood to weigh in with this stuff, because one of the casualties of this situation is we haven't really had too much. Almost all filming and movie and TV production has been put on hold. Yeah. You've seen some kind of one-man shows on Zoom, or Saturday Night Live doing Zoom comedy, but that's not really quite the same thing. And one thing I've seen is that movies and pop culture can really be instrumental in kind of shifting the course or shifting the tides for public health. Everything from cigarette smoking, which used to be much more glamorized in the movies, and a lot of public health researchers really drew a straight line between, James Dean or Marlon Brando smoking a cigarette in movies and that becoming so mainstream in the US, versus in the last 20 years when people tried to crack down on that and really not equate cigarette smoking with being cool. And that's led to, a big decrease in cigarette smoking, which has been a big win for public health. Mm-hmm. And that was something that my late father, a cardiologist, was really passionate about, public health messaging around cigarettes. Mm-hmm. So I'm hopeful that once people figure out how to make entertainment content and movies and TV shows again, that there will be some opportunities to weave in this type of public health messaging around COVID. And whether it's hand washing or distancing or masks or just how to think about testing, to me, that's really a way to change perceptions on a widespread scale, much more than just some new article that's published online. As much as I love to think that my writing can influence people and that your writing can influence people, I know there's something special about a movie or a TikTok video that gets millions of views. And I think those are really the types of things that really can, change the course of public opinion and public behavior.
Absolutely. I couldn't agree with you more. I think the power of film as a medium and as an influencer of human thought and society is enormous. And I think I've been touched and affected by so many incredible movies out there that have allowed me to have a perception of what is happening in the world throughout history. So I think it's a very powerful tool. And I think that, we get so used to looking at these people that we see on the screen. We feel so close to them because we've seen these emotions. The films are so adaptable, they're so, really do illustrate a narrative that we can apply to our own lives on various levels. And so I think it's natural for us to look at these people that we're used to seeing, and relating to all the time, and want to hear, what is the message? what is the message from them, and the people behind them. So I think it's very important. Do you think we can rope in Meryl Streep or George Clooney to come and talk to us?
I think we can. I'm in LA. We're in the right city for it. I'll work my contacts. You can work your contacts in health. My Hollywood and movies. That's a recipe for.
You talk to your people. I'll talk to my people. We'll see what we can.